This is a teaching video on orbital cavernoma. A pre-lacrimal approach was employed. I thank Carl Stores for the S camera and the S3 neurodrill system. We are Dr. JANAKIRAM, Dr. SHILPEE, SHARMA from India, and we operated this case in Hanoi. Patient presented with proptosis and she insisted on a no scar surgery. You can see here that the cavernoma is placed lateral, and it's typical popcorn appearance. You can see the axial view showing the displacement of the orbit. You can see that we decided to do this, the left nasal cavity. We are doing a middle meatal antrostomy. You can see that we are now taking a back biting forceps and doing a middle meatal antrostomy with the microdebrider. And once we do a middle meatal antrostomy, so that's the first step of a pre-lacrimal approach. And then we make an incision anterior to the inferior turbinate and elevate the inferior turbinate. We also elevate the anterolateral wall of the maxillary sinus, which you are seeing here, and then we drill off the anterolateral wall of the maxillary sinus and the anterior wall of the piriform aperture. We are now using a navigation probe. You can see the navigation very clearly showing that we have gone lateral to the mass, and now we have to start drilling the area just in the roof of the maxilla lateral to the infraorbital nerve. Now we are using the S3 neurodrill of Carl Stores. You can see that very beautifully it's irrigating and drilling. And now once we do that drilling lateral to the infraorbital nerve, we are exactly onto the tumor. We elevated the mucosa of the maxillary sinus, and you can now see that we are now going to deliver the tumor. It is a straightforward delivery of the tumor. You can see it's a cavernous hemangioma very nicely, just holding it with the Blexley, but the dissection is done with the suction tip. And you see that once we do that, we have now delivered that in total. That's the cavernous angioma. And the patient got instant relief of a proptosis. You can see this is such a simple surgery, no scars, and now we will suture back the inferior turbinate so that when you look at the nose, how do we reconstruct? We reconstructed mucosa using the mucosa of the maxillary sinus itself. We had reflected, so that goes onto the place of the drilling. And once we do that, you see how beautiful the mucosa is being laid over the area. Now we are suturing the inferior turbinate, and looks as if we have not done a surgery at all at the end of the procedure. So that's the suturing of the inferior turbinate now, and once we suture that, this is the final result. Thank you very much for watching.